Hello everyone, welcome to yet another episode of our Health Talks. With me today is two amazing doctors and we're going to be having an interesting conversation. But before we get into it, I'm Dr. Fiona and with me is...
I'm Dr. Rachael, a CEO, and just for emphasis that we're going to be having a Med Expo in combination with our Med Talks, which is the health literacy campaign. We shall be having a Med Expo at Uma Showgrounds, Lugogo, which will be taking place from 7th to the 9th of September. Please be there. We shall be there. So you should be there. Bring everyone. Bring your jaja, your mother, your children. Yes. Don't leave anyone behind because there is so much rich medical knowledge to share actually. Yeah.
Thank you so much, Dr. Rachael and Dr. Fiona. I'm called Dr. Kunsa Hudson Demetrios, and I'm here also to share medical knowledge.
Yes.
You guys come and meet us at Med Expo.
Yes.
The entrance is only 5K.
5K, guys. 5K. Yes.
Yeah.
There's going to be lots of medical experts, institutions,
Yes.
there's screening, there's
Yeah.
It's
medical
literally free of
information.
charge.
Basically. Yeah. So our conversation today is very interesting.
Yes.
And we want to talk about the health conditions in those over 60. Because sometimes that's a population that's neglected. You know, people like to talk about our, life expectancy being so low. And yet trends are showing that people are living longer.
Yeah, and
so
it's
people
increasing,
are living, it's increasing.
Yes.
So if people are living longer, it means that we have to cater for that population and understand what are the health conditions that are affecting them and also how they can maybe prevent them before they get there.
Yes.
So we're going to start with Dr. Rachael.
Yes.
What are some of these health conditions?
Okay, so when we talk about aging, firstly, when we talk about aging, we always forget that even our organs are aging. It's not just outside appearance, but also the organs are aging. So that means that the systems that were helping us initially are not going to be working as effectively or functioning as effectively as they should be functioning. So we'll talk about firstly hypertension. Yeah, this is high blood pressure. Yes. So here we have vessels that are become less elastic. They are more rigid. So when they're rigid and they're not moving flexibly as they, the pressure starts to increase. So when the pressure increases, that's when your pressure goes higher. So that's a bit common, yeah? So they say in the CDC that 1 in 3 people do not know that they're hypertensive, that they have high blood pressure. That's why it's important that when you reach above 60, above 50 even, you always have at least yearly checks on your blood pressure.
Is there a way that, let's say someone that's watching us is wondering, how do I know without taking the test? Are there signs maybe I can see I'm experiencing this and this?
Of course. Of course, there are signs. Firstly, you hear your heart beating, like do. Let's even give an example. Have you ever been scared? Yes, scared. So you even are aware that your heart is beating. That's exactly what you'll feel when your pressure is very high. Then you'll have headaches. Yes, maybe Dr. Kunsa can also add because I've talked so much.
About the blood pressure, it's very, very important to know that we call it the silent killer.
Yeah, true.
Because it's very easy to have it for quite a long time and you will not have any signs and your blood pressure will be high.
Like I said, 1 in 3 people do not know that they're hypertensive according to the CDC. So like he said, silent killer, you really are not aware that you have it.
And it's affecting every part of your body. And as it's affecting every part of your body, you get sick. And then by the time you start getting symptoms, meaning it's been there for quite a long time.
Yes.
Yeah, so it's a good thing to have some regular checkups. You come and check if your blood pressure is okay. Actually, it's a right that you can go to any hospital, ask for blood pressure measurement free of charge.
Yeah, without
Did you guys know that? Any hospital, you just enter and then you ask, can you take my blood pressure? And they are not allowed to charge you anything.
Yes.
Yes.
Yeah.
And also, the good thing is that there are things you can do right now as you're young, so that in the future you don't, you have reduced your risk at least, you know, if you're eating healthy, you're being more active.
Because you see, when we talk about the weight now, the weight, you're having a lot of fat in your body, so it's going to compress your blood vessels and add, you know, the more pressure build up. So there is all like healthy living. Actually, by the time you start aging, now you need to really make better health choices because you're susceptible to more
Actually, when you talked about the weight and then things building up, that brings me to something else, which is the heart attack. We've had people talk about heart attacks in people over 60. Maybe Dr. Kunsa can start us off on the heart attack and then...
Heart attacks. So it's something that, you know, I have this friend of mine, he's quite old. He's 70 plus, so he made a joke. He told me that anytime that you wake up when you're above, let me say 70, and you wake up and you don't feel any part of your body hurting, you know what it means? It means you're dead.
Wow. So you're waking up and you're dead. Like,
so it means like you, as you grow old, some part of your body will start hurting here and there. So heart attack is one of them. We have the heart is supplied by some blood vessels, and this blood is necessary for your heart to work. So if there is anything that causes blood to reduce going to your heart, it will die off. Some part of it can die off, and that will be the heart attack. And mostly those people will get, or those patients will likely to get chest pain, very severe chest pain, and sometimes they can die suddenly. So it's common in as we age, it's common the way Dr. Rachael mentioned that blood vessels are becoming thick. As they're becoming thick, even the blood that is going through will find it difficult to go through. To supply your heart. So meaning a certain part that is not supplied can die off. That's the heart attack. And we also find that high blood pressure, hypertension, as we mentioned, which increases with age, it also somehow contributes to heart attack.
Heart disease.
So if you have a high blood pressure, most likely you're at a very high chance of getting heart attack.
And you know that the heart is working so much in high blood pressure, the heart is working so much. So, you know, when something works so much, I'll give an example. When you go to exercise and you're at the gym and you're working your muscle, you start, you know, it starts becoming bigger. So that's what's happening to the heart. It's trying so much. Yes, it's overperforming. So at the end of the day, it's also going to get exhausted. We get tired when we overwork ourselves. So the heart is part of us. So it's going to get tired with this pressure. And, you know, when we're talking about obesity and the overweight, we're having high levels of cholesterol in our bodies. So also this can accumulate in the blood vessels. Accumulating the blood vessels, causing a blockage like Dr. Kunsa had talked about. And sometimes the blockage might not stay. It might dislodge and go somewhere else. Then you get a stroke. Then you get a heart attack, like we said. I think heart attack is a little bit relatable. We can understand that. It's not a heartbreak, it's a heart attack.
Talk a bit about the eyes, because we've all seen old people and then they're reading and then the book is, you know, like an arm's distance away, or they just can't read small text or something. And because as you grow older, like we said, these cells are just not maybe replicating or dividing at the normal range, and also they're not able to, like, your body starts to fail, including your eyes. And so one of the things that can happen with your eyes is that there could be dryness in the eyes, first of all, whereby the eyes are irritable, they become red. And then there are those that can experience situations where they are over tearing. Like you see a person, they're just seated, they're not sad, but they have tears flowing out of their eyes. And then also, like we said, they're failing to read, you know? But a good thing is that there's hope. You know, you can get reading glasses and actually be able to read. If your eyes are dry, there are eye drops that your doctor can give you that can help you actually be able to see and
better,
so the eyes are, they also affect
and actually they can also transplant new lenses. If you get it early, there is a transplant and then you can get better with vision. Yes. So secondly, we also have to talk about the cancers that are common, because I think you guys have heard that by 65 we have to check for prostate screening, we have to check breast cancer, we have to check our breasts. So it's important that we start screening early by the time you're older, because you are at risk of getting these cancers. And when you get them early, trust me, the chances of you getting better are also high. You can actually live for more than 19 years from 60 because we are being more cautious about our health. So we encourage screening of different cancers. Then we shall talk about the joint pain.
So about the cancers, it's very important to note, like the cancers, as we say, that usually our cells are dying out and then they're being replaced. And then that's how the cancers come about. Like some cells come and they don't want to die, and then they start growing and then they form a cancer, in simple terms. And then you find that as the more we grow old, our risks of cancers increase because of several reasons, like our lifestyle, our genetic predisposition. So you find like a lot of things are happening in the world, and then like those changes are contributing to our lifestyle change, which is probably risking the chances of cancers. But it's, as doctor, you mentioned that it's very important to get them early. We get them early, we can either cure them completely or you can have a normal life, like you go back to basically a normal life, or we can even improve your quality of life. You could find that maybe possibly your cancer was quite advanced, but it doesn't mean that we can't help you. We can still help you so that you have an improved quality of life still with your disease.
I hope for someone that's watching us and you feel like, hey, they told me. Because sometimes people think cancer is a death sentence, but there's hope. Early, when they find it early, the chances are better. So let's talk about neck and back pain. Because we've all seen, your mother, your grandmother is like, my back wants to kill me. So what is it about age and back pain and neck pain?
And even joint pain, So when we look at our joints, like what's the joint? Where two bones are connecting. So in there is some fluid that helps that the friction, the tearing and wearing between them can reduce. So over time, when you're growing old, of course, the wear and tear, I don't know if that's a little bit simple, the wear and tear kind of increases. So you start to feel pain because of that. And this also brings to arthritis. There is some kind of redness and swelling around that when we talk about the arthritis. So sometimes when you wake up in the morning and you feel like, oh my God, I feel stiffness, I can't open my hands well, my joints well, I'm in pain, I take long to start walking until I've stretched out, go see your healthcare provider and start from there. And also they can give you over-the-counter medications to help with that pain. You don't have to suffer, honestly.
And there's also physiotherapy.
Physiotherapy, so they'll help you with the different exercises that you can do at home or with your healthcare provider. So also an emphasis of what we call weakening of bones. Mostly in women that have entered menopause. So there is that beautiful hormone that we all have, as women, the estrogen hormone. It helps with the formation of some cells and all that. So when you become older and you enter menopause, sometimes your bones can get weak, and that's why we emphasize diet a lot. You can supplement with vitamin D, you can take some calcium-rich foods, which is like milk, some veggies there, have them taken in. It will help you out.
The joints, like, it's very important because like you see, we really get a lot of them. A lot of patients, they'll come to you, joint pain, mostly the back pain. But also like when you look at some of those different things that we can advise you about, like there is what we call is it an orthopedic bed?
Yeah, and that hard,
hard
very
bed.
hard bed.
Yeah,
yes.
so that hard bed is good. You know, most of us, we want soft mattresses and everything.
The spring.
Yeah, but then like it's one of the causes of back pain. So if you're there and you're feeling back pain, one of those is to go to your health provider, your doctor. He can advise you and see if that hard mattress can help you with back pain.
Yes.
Yeah, it's one of them.
Add something.
Yeah.
Posture. You know, sometimes the way we are sitting, the table you're using to work on, you're constantly bending, so you're also putting a lot of stress on your back. So eventually, you're more likely to even get them, because some of these health conditions, we are saying they're in over 60. They are common in over 60-year-olds, but you could be 30 and you're relating. You get so. Yeah, so I want us to also talk about our breathing, the breathing system, because there are times when you receive patients and the patient is wheezing, you know, they're making sounds with their breathing, their chest is hurting. Dr. Konsa, tell us something about such patients.
Yeah, so the breathing, like we know that our brain can't survive for how long? I think 3 minutes.
3 minutes, yes.
For more than 3
minutes
minutes without oxygen.
Yeah.
So this breathing system is precious.
Very precious.
Yeah, it's very precious. So, and we see that we have a lot of conditions that affect it. Like we see let me say, if you've been a smoker, you could either be a passive smoker or an active smoker. You're usually exposed to getting some disease conditions in a long time.
Yeah, even like, those who cook with charcoal.
Yeah, those who cook with charcoal.
Yes.
Sometimes you might not smoke and your neighbor is smoking.
All that.
Yes. And then it can give you, we call it COPD. Yeah, and chronic obstructive pulmonary disease. And sometimes this disease will mimic TB. And like most of patients who go to several health centers, and sometimes they might think it's what? You have tuberculosis. But it's another condition of the lungs that will cause you to cough and have that too much sputum. Sometimes you have difficulty in breathing and all that.
And making that sound that you say.
Making that sound. You feel some things crying in your chest. Yes, and then but we can also manage it. And the way Dr. Fiona mentioned that it's very important to look at your lifestyle, how you can prevent these things. So from the start. So if you can avoid smoking, being exposed to those fumes, and then also your workplace could be a place where there is
even
fumes. It's aerated.
Yes. You're then using a cooker.
We have now this mining industry, you know, like right now in part of Mubende, there is a gold mine and others. So this can also, you know, when you're inhaling those dusts into your lungs, they will affect it in a long run.
Your occupation can also
affect it. And then later in life, you'll be having difficulty in breathing, and then you're coughing and all that. So if you know these things, you can easily be able to treat them.
And your healthcare provider also recommend, because there are those people, you come and then they feel like now you should stay on oxygen constantly. And then there are those, it would just be like an attack. They'll give you the oxygen for that time. Then they'll advise you and give you other medications that can also help you. So something else I want us to talk about is the hearing. Because there are times when you're talking to your grandmother and you're like, is she pretending not to hear me, or is she really not hearing me? What is it about our ears and aging?
Okay. Maybe Dr. Konsa will tell us.
Okay, that hearing, the way we said, it's like literally our parts are wearing out.
True.
They are growing old with us. So the hearing, most of these things that we mentioned about, it's very good to go to your general practitioner or the doctors or a specialist, so that they can check them out and manage you in the right way. So hearing, you can find that hearing, someone can tell you, I'm not hearing in both ears. And then you'd find that it could be the cause that it's maybe in the ear, or it's where
the brain, the connection.
You know, the brain is responsible for your hearing. This just takes the information there. So one of the common things is you could have wax.
Yeah.
You know, we have this this habit of using the cotton pads
to put, and we're pushing back the wax instead of
further,
allowing it to come out naturally.
Exactly.
Yeah.
So it can block completely. You find something dark, black, and solid, like it has closed off completely. So most times, if you get hearing loss in mostly one ear, and the other is hearing, could be one of those. So still go to your doctor, and you can be able to check it out.
And also something else I want to add about the hearing is that in older people, most times it's the high-pitched sounds. So they'll be hearing the low-pitched, but the phone can ring and the person will not be able to hear it. So that's one of the way it will present. And one thing we can do to sort of like prevent it is these repetitive sounds that we hear, maybe machinery, those are some of the sounds that can actually affect us in the long run.
Noise pollution.
And you know, and if you're out there and you're having hearing problems, there's also hope. Because they are hearing aids, you know, in case you've already lost your hearing, and maybe you can get hearing aids and they can help you. And then in case it requires surgery also, sometimes you require the surgery. You have to see your specialist, and then, you know, there's hope.
So we also can talk about the mental health, where we have to emphasize depression in old people. Because most times we tend to neglect them. They're staying alone. They are no longer working as they should. So there's a shift. They're lying in bed alone. They're alone. They're so lonely. They're maybe if they had a spouse, maybe the spouse also passed on. So they need that support. In fact, if they can stay with you, though, we know our grandparents want the village, but it for emphasis, they need to be around people. They need to, you know, have presence, because that can also be quite common in old age. And then the memory loss, dementia, all that.
It's very memory loss. It's really like you can see your grandmother or your grandfather really like forget your name. He's asking, are these my children?
It's actually painful, you know.
Painful,
but they also show that having the high blood pressure and the high blood sugar, which we actually didn't talk about, can increase your risk of that memory loss, that whole thing we call dementia. So even the diabetes. But you know, we have so much to talk about that if we had to start, it can't.
But we've tried to, you know, talk about the most common, the ones that are likely to affect you the most. So in case you have one that you feel they haven't talked about, you can comment and
we emphasize.
I'll be very happy to respond and
like the way you see someone can tell you, like my grandfather would tell me, I've taken 40 years without going to hospital. Me, I don't get sick. So it is very important, even if you're not sick, to get some time. You go to hospital for a general checkup. Just general checkup. They can pick up something, and then they be able to really manage it. It's good that you won't be going to hospital, but it's good if they do a checkup. Exactly.
So just an emphasis, when we look at immunity, when the extremes of age, the young and the old tend to have a low immunity. So just to emphasize that as you're aging, or even before, because it's good to start early. We always use the common term, prevention is better than control. You have to start minding your immunity. There are vaccines we give for old people with pneumonia. And other things, the flu shots that can boost their immunity. Then there is the healthy lifestyle, stop smoking, like Dr. Consard emphasized, eat a balanced diet, sleep enough, do some exercises.
Being old doesn't mean that you don't do exercises. There are exercises for.
Not very strenuous.
Exactly.
Okay, so I think that's it for this session.
It's been very interactive. I believe you've learned something. Comment, tell us what you have learned, and don't forget to like, subscribe, and share with someone.
Yes.
Thank you.
Okay.